Good afternoon, everyone. Thank you for joining us. Today we put together a presentation about mindful eating. Remember, both the Mediterranean and the vegetarian and vegan pyramid included recommendations about how we eat, not just what we eat. So that's what we plan to tackle today, how we can slow down and introduce this idea of mindfulness around food. My name is Veronica and I'm a registered dietitian, and I'm co-presenting today with my registered dietitian colleague Fatim that I work with at Toronto Rehab Cardiac Rehab program. The ground rules haven't changed. This presentation is for education only, and you'll have the opportunity to ask your questions with that Q&A icon at the bottom of your screen. Remember, when you do submit a question, we can only answer questions generally, not personally. So if you would like a more specific answer for your situation, please follow up with your registered dietitian or healthcare provider. Today's objectives are to understand the basic principles of mindful eating. We will discuss the 3 different types of hunger. We'll also introduce the idea of analyzing your hunger on something called a hunger scale. And we will end with discussing triggers to emotional eating. We're going to start with a video that we have on our website. So I'm going to link to that now. This is our website, Cardiac College. It's part of the Thrive series. So it's this button up at the top right. And you can scroll down. And the video we're going to watch today is called Develop a Healthy Relationship with Food. So I'll play that here.
How often do you think about food? Do you notice the smell and taste of the food you are eating? Do you think about the way food makes you feel before and after you eat? For many people, the stress of eating the right food in the right amounts at the right time has made it hard to enjoy food. Wouldn't it be nice to enjoy food again? Eat without judgment? Have a better appreciation for food? You can. Mindful and intuitive eating can help you develop a healthy relationship with food. No rules, no diets, just eating to feel energized and be healthy. This weekly challenge will help you think about your relationship with food, your food choices, and your feelings when you eat. Then you can create an action plan to help you become a mindful and intuitive eater. The media shares a lot of information about diet and weight loss. You may have got the message over time that you shouldn't eat for pleasure. Maybe your doctor told you to lose weight. The problem with focusing on diets to lose weight is that it often doesn't work as a long-term solution. Diets are restrictive, and they often label food as either good or bad. Restricting food to follow a diet or lose weight can lead to undereating, overeating, and missing out on key nutrients. There is an emotional side to eating too. Trying to follow a strict diet can lead to feeling shame or guilt when you eat something outside your diet plan. It can also make dinner time a stressful event. Instead of following a long list of rules, try mindful eating. So, what is mindful eating? Mindful eating is when you take notice of all that surrounds you before, during, and after a meal. It's being in the moment and involves using all your senses: sight, smell, sound, taste, and touch when you eat. It means you are aware of your thoughts, feelings, and actions around food because you are fully present and paying attention when you are eating. It sounds easy, but eating mindfully takes a lot of practice. Over time, you might find that you start to notice details in the way food tastes, smells, and feels. Eating this way allows you to experience food in a new way. you can start to make a choice to eat certain foods, free of guilt and judgment, and let go of expectations for your body. You might find you are currently eating a lot of things you don't really even like, just because they are convenient, or because that's what you've always done. The next step is intuitive eating. It builds on the idea of mindful eating. Intuitive eating is eating in response to what you feel inside your body, eating when you are hungry, and stopping when you've had enough. It's about eating for the purpose of nourishing your body and getting energy from food. Think about the reasons you eat food. Is it because you're hungry? Or is it because the clock on the wall says you should? Before your next meal, ask yourself how hungry you are on a scale of 1 to 10. 1 means you are starving, and 10 means you're too full. Knowing how hungry you are can help you decide what kind and how much food to eat. Do you eat when you're bored, or do you eat socially? Which foods do you choose in which situations? And how do you feel after you eat? Are you feeling satisfied or bloated and tired? Happy and content? Or guilty and embarrassed? When you are aware of how your body and your emotions respond to certain foods, you will intuitively choose foods that make you feel better. That's intuitive eating. Mindful and intuitive eating is a long process with lots of learning along the way. If it's important to you to develop a healthy relationship with food, make an action plan to work towards this change. You might try one of the tips from this video or focus on something else this week. Remember, a small change to develop a healthy relationship with food is a big step closer to better health.
I hope you enjoyed the video. I guess I'll ask everyone maybe if they could contribute to the chat function or the chat box, just reflecting on what you learned from the video. I'm interested to understand, what stood out to you. Was there anything surprising? Is the mindful eating concept, is it the first time you've heard of it? Any comments below, or any comments that you have, please contribute to the chat box. There's a response here. It's important to think about what you eat, not just eating for the sake of eating. And absolutely, it definitely is important to do. And that's what we will be talking about, to slow down so you have that opportunity to think about what you're eating, and not just going through the motions. The video did mention that, it's a concept that's new to a lot of us in Canada, and it's something that takes a lot of time to practice, but the more you practice, just like anything else, the better you become. So thanks for contributing to that. We'll continue with the presentation, and I really like this definition that's displayed on the screen here. It talks about not only mindful eating, but also the idea of mindfulness and how they interrelate. So I'll read it out loud here. It says, mindfulness is deliberately paying attention, being fully aware of what is happening both inside yourself, so that's in your body, your heart, your mind, and outside yourself. That's your environment. Mindfulness is awareness without judgment or criticism. Now, mindful eating is an experience that engages all parts of us, our body, our heart, our mind, in choosing, preparing, and eating food. Mindful eating involves all the senses. It immerses us in the colors, the textures, the scents, tastes, and even the sounds of drinking and eating. It allows us to be curious and even playful as we investigate our response to food and our inner cues to hunger and satisfaction. Now, there are 8 basic principles of mindful eating, which I'll go through now. The first is to be mindfully aware, which means to change nothing, just to be more aware of of your actions, of your body, of your environment. And it's just to, like I said, raise awareness to make each bite more meaningful. So when you are eating, you want to smell and feel and look and savor and really taste your food. You can even think back to your breakfast today. Did you do this? Did you smell your food before you ate it? Did you look at the colors that are on your plate? Becoming more aware will increase the time it does take to consume into all your senses, will increase the enjoyment of each bite. Another principle is to observe your body. So before meals or snacks, simply slow down. You can use a deep breath as an anchor to pull you back into the moment. I'll invite you to take a deep breath with me now. Breathe in and out. See how it can slow you down? So try to use this technique before you eat dinner tonight to try to observe your body and tune into, your hunger and how your body is feeling. Another principle is to shift out of autopilot. So whenever you eat, ask yourself, am I eating out of habit or hunger? Am I eating mindfully? This means you make a conscious decision to eat rather than just going through the motions. Does this sound familiar? Can anyone relate to this? I know I can. Even when I think back to my breakfast this morning, I catch myself eating out of habit. I get up in the morning and I pour myself a bowl of oatmeal, but did I ask myself, am I hungry? How much I need or what exactly I need to eat? Nope, I just went through the motions because it's time for breakfast. The clock told me to eat. So it's important to consider before your next meal. You can be mindful of the environment. So notice how your eating habits shift from place to place. I know we're not going to a lot of places right now, but even just notice how your own environment at home impacts your eating habits. For example, if you put healthy foods in a highly visible place, like having a fruit bowl on the countertop, or perhaps chopped up vegetables in a clear bowl in your refrigerator, does this increase the chance that you will reach for a healthier snack when you're hungry? Quite likely. Something to pay attention to. To be in the moment. So avoid multitasking when you eat. Turn off the TV, put down the magazine or your cell phone. When you eat, just eat and keep your mind at the table and try to be in the moment. I think this is the one that we think about the most when we hear the term mindful eating, is to try to be in the moment without distraction. But there's a lot of other principles that make up mindful eating. Another one is practicing non-judgment, to speak mindfully, to be aware of your critical thoughts about your habits or your body. You want to move away from rigid food rules and use your mindful instincts. So food isn't good or bad, it's just food, but we're very critical of ourselves. I want you to know that all foods can fit. It's just about moderation, and I hope you've learned that in the last couple of presentations we've had together. But I want you to try not to judge yourself for eating certain things. It's just to simply become more aware of what you're eating and then move on from that. And then another principle here is to let go. So let go of expectations for your body. Work on letting hurtful thoughts and emotional urges to eat go by without reacting to them. You want to respond to these expectations or thoughts rather than reacting to food cravings. So the fact that you have a thought, a feeling, or even a craving doesn't mean that you have to act on it. Try to become aware and then respond to it instead of that habit or that reaction that you typically experience. There we go. Practice acceptance. So you want to adopt an attitude of it is what it is. You want to accept your body and your hunger as it is and not punish yourself, with those starvation diets. And we just want you to not dwell on the past or actions that you've participated in. You just want to accept the moment just as it is. So these basic principles are summed up really nicely in this graphic by Dr. Susan Albers, who created the principles as well. But this is something that you can quickly Google, and it's probably one of the first images that come up, but it summarizes these principles nicely, where you can print off this image, you can put it on your fridge or somewhere that can help you remind yourself to engage in these mindful eating principles. The picture reminds us to, be aware by tasting our food, to eat instead of our food, to notice the texture, the aroma, the flavor. There's so many. Like, is your food crunchy? Is it sweet? Is it salty? Is it smooth? Is it spicy? Try to understand what you're eating. Another part of the plate here is to observe. So you want to observe your body. Maybe it's your rumbling stomach. Maybe you have low energy. Maybe you're stressed out. Maybe you feel full. It's just a matter of, slowing down, taking that deep breath, and trying to observe how you're feeling. Also be in the moment, to be fully present. Remember to turn off the TV, to try to sit down at a table when you eat and just eat. And then this picture also reminds us to be non-judgmental. And remember, this is probably, I think it is one of the hardest parts that a lot of my patients struggle with. They've been judging themselves for years and years, and it's quite a different mentality to try to be non-judgmental and just be present or be aware of your thoughts. And I hope too that you become more compassionate towards oneself. Instead of guilt, you just notice it when it pops up, and then remember to let it go without judgment. So those are the principles of mindful eating. And we'll now jump into something called different types of hunger. There are many different types, but we've presented 3 here. One is called stomach hunger, one's called mouth hunger, and another is called heart hunger. So stomach hunger is the type of hunger, we're all aware of. It's the one that's described as the physical or medical necessity to eat. It's when your stomach's growling and it's asking for nourishment. Mouth hunger is a craving related to the senses. So if you've eaten a meal or snack recently but feel like the desire to eat, you may want to take a moment to explore what exactly you may be craving. Is it a particular food? Is it something sweet or savory? Is it something crunchy or salty? Maybe it's something cold or warm. So once you've identified what you're craving, you can eat a reasonable portion of it and savor each bite, and that will satisfy that mouth hunger. And the last hunger is called heart hunger. So that's the emotional trigger or learned behavior. Again, if you've recently eaten but you find yourself back in the kitchen, slow down, ask yourself what you're feeling. It's completely normal to eat when you're sad or stressed. However, food only temporarily blunts the emotion you're experiencing, only for that emotion to reappear. So if food is your only coping mechanism, you'll eat, you'll feel better, but then the emotion will come back and then you want to eat again. And it's this cycle. So take a step back, slow down, try to observe what you're feeling, and then look in your toolbox for other stress management activities that can help soothe and nurture yourself without food. Slowing down and practicing mindful eating allows us to assess which type of hunger we're experiencing. Chewing our food well, eating distraction-free, helps us become more aware of how we're feeling. If it isn't true stomach hunger, maybe you need to pick up the phone and chat with a friend to satisfy your heart hunger. Or perhaps it's to drink a warm cup of tea to satisfy mouth hunger. When we're slowing down, becoming more aware will help determine what you need to feel satisfied. Now I'm going to pass the presentation over to Fatim to continue this discussion.
Okay, thank you, Veronica. So let's talk a little bit more about hunger. So we saw that in the video, they talked about something called the hunger scale. So when we look at hunger, it's a natural sensation and it shouldn't be ignored. It's something we do need to pay attention to. So the hunger scale is a tool that encourages us to pay attention to our body and what it's telling us. It's a way to tell when you should eat and when you're satisfied and full. So why don't we take a moment right now, focus your attention on your stomach. Try not to think about the time of day it is or when you've last eaten, but just pay attention to how your stomach is feeling right at this moment. So, how are you feeling? Are you at the middle of the hunger scale? Are you at maybe 6 or 7 where you feel satisfied? Or are you really hungry? Maybe you haven't had a chance to eat lunch yet and you're at a lower number. Or perhaps you just finished eating and you're feeling full and you're at a higher number. For most people, enjoying their food and feeling comfortable happens usually when you're between 4 and 8 on the hunger scale. If you ignore your hunger signals or skip meals, you might go to that 1 or 2. And this is when you'll likely feel jittery or shaky. You might be irritable. And it's really hard at this point as well to pick healthier meals and take time to plan out what you're eating. You're probably feeling like you can just eat anything in sight at this point. On the other hand, you might have eaten to the point of satisfaction, but you continue eating, maybe because it just tastes good, or maybe because your mind is telling you to keep eating for emotional reasons. And that's where you can end up with the hunger scale at a 9 or a 10, where you physically don't feel so comfortable. So using the hunger scale is a good tool to keep track of your physical hunger. And so instead of eating on autopilot, as Veronica mentioned, or eating according to a rigid schedule just because of the time of day, maybe try using the hunger scale before, during, and after you eat. It's just one tool that you can use to help you eat more intuitively. I apologize, I just noticed there's some comments that the screen is blocked. Can you just let me know if
sorry about that. Is it still blocked?
There's just a black box on part of it.
Yeah, that's interesting. I can't see it on my screen.
No worries. Okay, so it seems to be a little better now. Maybe before we go on to the next slide, let's go back a little bit and talk about the reasons why we eat. So Veronica talked about the different types of hunger, but we can maybe think about all the different reasons why we might eat. And if you want, maybe you can think about a couple of things and maybe type them in the chat box so we can go over them. So think of all the reasons you eat. It might be hunger, but there are many, many other reasons why we eat. Okay, so I have one answer that's come up. Routine. Absolutely. Sometimes we eat because we're just used to a certain routine or having meals at certain times of the day. We eat for when we're bored. And I think that's very valid. A lot of times it's just something to do. We eat for physical reasons, like to get energy. Absolutely. Great answer here. We eat as a social event. And that's a huge part of eating. It's that pleasure. It's eating with family or friends, maybe not so much right now, but in general. It's being exposed to food, being up at a party where there's lots of food around and maybe there's expectations that you'll eat. Food provides us an escape from stress and unenjoyable activities. I have an answer here to celebrate an event. Absolutely, food is a big part of our celebrations, whether it's special holidays, birthdays, graduations. Food is a big part of that. Sometimes we eat just because we enjoy the food. So I have an example here, the coolness and creaminess of ice cream. And another great answer is I eat food because of getting rid of leftovers so we don't waste. And I think that's a big part of it. I think a lot of us were brought up, being told to clean our plate, regardless of whether we were hungry or full, not to waste food. We don't want to throw away things. And so we're eating not because of hunger, but for other reasons. So let's look at some of the triggers around food. So a trigger is defined as anything that serves as a stimulus or initiates a reaction or a series of reactions. A trigger can be anything that we see, hear, smell, touch, taste, or feel that evokes an emotional response. Physical triggers can be people, sights, sounds, and smells. Examples might be, hunger or eating brought on by watching someone else eat, or maybe watching a commercial about food, or smelling the aroma of fresh baking as you walk by a bakery. Triggers can also be body signals, like your hunger or fullness level, or experiencing a low blood sugar. Then we also have mental triggers, which are thoughts, and emotional triggers, as Veronica touched upon, that can be feelings or memories. Awareness of a trigger doesn't always mean that you need food. It just means that something is happening. And that's where that pause comes in. So maybe take a pause, explore your emotional state, and think about things that might make you feel better. Common triggers to emotional eating include things like stress, loneliness, boredom, or a lack of control. And I think, especially now, during COVID-19, these are very real, and a lot of us are experiencing these on a daily basis. So maybe that's where you pause before you reach for food and think about your feelings and maybe what else you could do to alleviate those feelings or make them less strong. And we think about comfort. I think a lot of us grow up being comforted by food. Even as babies and children, food is comforting. Food is often readily available, and eating is a quick way to comfort or nurture ourselves. When we're stressed, we often give ourselves a break or a reward or a pick-me-up using food. And it's a hard habit to get away from, but it is possible. So to get away from using food as your comfort, we need to first of all work on finding the cause of our stress and maybe trying to reduce that. And then also replacing eating with other simple, pleasurable activities that can comfort us or reward or re-energize ourselves. So you might think of curling up with a book or watching a show online. You might listen to a soothing podcast or music, maybe taking a bath or just calling a friend. If you have a pet, those are great ways, playing with your pet is a great way to relieve stress. If you're able to go outside, maybe you're not walking too far these days, but it might be just getting outside in your garden and enjoying nature. Once the self-isolation phase is eased, you might think of doing other things for yourself, like maybe getting a massage or browsing in a bookstore or going window shopping. There are many ways that you can nurture yourself without food. So find ways to do something for yourself that doesn't involve going into the kitchen and grabbing something from the fridge or the cupboard. So maybe take a moment right now to think of 1 or 2 ways that you can nurture yourself in the coming week. Veronica and I just touched upon some basic principles of mindful eating. If you are interested in learning more, these are some resources that you can use. So the first 3 are websites that give you resources and more information about mindful eating. They also give you links to courses that you might take online or in the community around mindful eating. And then I've also put 2 books that I found very useful. The first one is called Mindful Eating by Jan Chosen-Bays. And she goes through all the basic concepts of mindful eating. And what I like about this book is it also comes with a CD where you can listen to some mindful meditation and mindful eating practices. The second book is called Eat, Drink, and Be Mindful, and this is by Susan Albers. Again, a good basic start to mindful eating. And both of these books are available on Amazon and on Indigo online if you want to order them. So that's sort of the basics around mindful eating. Again, you can always reach out to myself or Veronica or any other dietitian if you are interested in working with a dietitian to learn more about mindful eating and right now.
Great. Yeah, there isn't actually a lot of questions here. Some of the questions in the question box are actually comments about that big black box on the screen. And I, again, apologize for that. I have no idea what that was. I wasn't seeing it on my screen. So I'm glad that we were able to figure that out for you.
Okay, I think maybe there's a few questions in the chat box, actually. So there's a question here, a great question. Some medications need to be taken with food. And although I am not hungry at this time, this throws my daily food plan out of schedule. And I think that's very real for a lot of patients. So if you are required to take your medication with food, there's a reason behind that. There's maybe better absorption, or it's easier on your gut to take it with food. So you do want to follow guidelines there. And maybe what you can do is maybe plan your schedule around your medications and see what works best for you. But there are always exceptions to eating just because you're hungry. And I think this is a valid one.
Great, thanks, Fatim. There's another question that came up, and it reads, how do you deal with specific cravings? And when we're thinking about cravings, or if food cravings come up, I always suggest that you respond to them. So again, take a second to maybe take that deep breath, become aware of what exactly you are craving, and then eat it. That's okay. If you do have cravings, it's telling your body that maybe you need those things. And if you don't satisfy that craving and you try to do something else instead, you try to eat something else perhaps instead, your body usually still is craving that certain thing, and you'll end up eating whatever that was before, and then you'll probably eat that craving later, or that craving will continue to linger. So what I do suggest is to respond to what your body's telling you, and be mindful when you are eating it. So when you have that craving, identify it, and then plate it, put it on a plate, bring it to your table, make sure that you are eating distraction free, and really savor it. When you eat in a more mindful way and you pay attention to your hunger, or perhaps this is your mouth hunger, maybe you only need 1 or 2 bites to satisfy that craving. And when you eat in a mindful manner, you can identify that and see how much you need to be satisfied.
Okay, thanks, Veronica. So question here, post-cardiac event, how to be mindful when it's difficult to understand what and how much to eat. For example, what type of nuts and how much, how many eggs a week, can I eat egg whites or the entire egg? And these are great questions, and I'm sure a lot of our patients are concerned with this. What I would say is maybe take a look at some of the information on Cardiac College under the Eat Healthy section. We've also done some presentations in the past couple of weeks around sort of what the best diet is in terms of your cardiac health. So that will give you a general overview of the types of foods to include more often and the ones to maybe limit. But I think you still want to incorporate this mindful and intuitive eating. Everyone is different. So in terms of the amounts you eat, that's where you might go back to your hunger and fullness cues and pay attention to what your body is saying. And then look at your own individual circumstance. Now, we know with the research around mindful eating, when you do become more aware of your body and being in that moment and paying attention to different cues, you get to understand what your body needs. And we know from the research that people who do eat mindfully tend to make healthier choices overall because they know what their body is asking for. But do take a look at the Cardiac College website and maybe some of the videos that we've recorded in the past couple of weeks to give you a little more information about what the best diet is post-cardiac event.
Thanks, Fatim. There's another question about oil. So after recovering from heart surgery, is it okay to fry your fish in oil? And when we are cooking, we do recommend baking and sauteing more often than frying. And we do suggest trying to avoid or limit the deep fry. When you are cooking fish, you could do a quick sear on the stove top, and definitely use oil when you are cooking. We have discussed different types of oil throughout the last webinars, and we do encourage the use of olive oil because it has the most research behind it to support heart health. So if you can use olive oil, and that type of oil can be used on a moderate to high heat, so it can be used to sear or bake in the oven as well.
Okay. So there's a question, I think, very specific to chemo about taste changes after chemo. So right now, everything leaves a bad taste in my mouth. How long will this last after I'm finished? Sometimes when I eat, something tastes okay, then later it feels bad. Any suggestions? So definitely, if anyone's been through any type of cancer treatment, chemo can change the way you perceive foods. It can make things taste bitter or bland. Sometimes you lose the enjoyment that you normally get from foods. I think this is something that maybe you can talk to your doctor about in terms of the type of chemo that you're getting and how long the side effects will last after that. Generally, most people do get over these taste changes over time, but it's hard for me to answer in terms of how long it will last in your particular case.
There's another question about in the middle of the night, I wake up and feel I need to eat chocolate. Is this normal? And is it normal? There's no normal, I would say. Something that you want to determine for yourself, right? Mindful eating is trying to become more aware of how you're feeling, what your body is asking for, and responding to it. So in this case, if it does happen, you could always do an experiment. Wake up in the middle of the night, have that chocolate, be mindful about it, go back to sleep, and see if that helps to deal with the craving. If it doesn't deal with the craving, then perhaps there's something else going on. Maybe it's heart hunger that you're experiencing. Maybe it's something that happened during the day, and you were craving chocolate and you didn't respond to that craving, so it's coming up later. It's very variable to your situation, so I would encourage you to do some journaling, reflect on how you're feeling throughout the day, and see if you respond to your cravings throughout the day. Does that happen overnight? And again, it's kind of like an experiment or trial and error to see what can satisfy those cravings. And like Fatim mentioned too, you want to be able to nurture yourself instead of nourish yourself. So are you nurturing yourself throughout the day? Are you taking care of yourself? Do you have time for self-care? And maybe does that help with cravings overnight? So try different things out and see what works.
Okay, great, thank you. So there's a question here. Any thoughts on mindful shopping during COVID and the link with mindful eating? Great question. So when we look at mindful eating, it's not just thinking about food while we're eating, but it's the planning phase as well. And that's where mindful shopping can come in. We always recommend, having a shopping list and planning out some meals for the week that are healthy. You might be planning for a lot longer if you're going shopping less often right now, or shopping online. So having that list and having that plan is always a great idea. If you do go into the store and you're able to actually get into the grocery store, I think one of the things you might want to pay attention to is your hunger when you're grocery shopping. So not going in when you're at, a 1 or a 2 or a 3 on that hunger scale, where, you're just so hungry that you're going to purchase things that you normally wouldn't because you're just hungry and wanting to eat. I think that's when we tend to make not so healthy choices. So maybe having a meal or a snack before you go out, and then going in with that grocery list and that plan. So you do have healthy food on hand. And I think Veronica mentioned a great example that if you do have that bowl of fruit on the counter or cut up vegetables in the fridge, you're much more likely to reach for those than if you have, say, something like cookies or chips or something in sight. So I think mindfulness absolutely is part of the planning and shopping phase as well.
Great. And another question, what foods are to be avoided to prevent plaque buildup? And in the past presentation, what are heart healthy foods and what is a heart healthy eating pattern? So those are two webinars we've had in the past. So I would encourage you to link back it and watch those. But I would reframe that question and think about it as what foods should be included to prevent plaque buildup, because there is a lot of evidence about what foods we should be eating more often to help with this. And for example, those would be things like olive oil, plant-based foods, so that's your whole grains, your plant-based proteins, such as legumes or nuts and seeds, your soy products like your tofus, having fish more often than red meat. Those would be the foods that have a lot of evidence that will provide you with heart healthy benefits, and those are the ones we want to include more often. When we think about things that we need to include and we focus on the positive, we don't leave a lot of room for things that we don't need to eat a lot of, or things that we need to limit. Of course, the things we need to limit would be things like added sugars, perhaps trans fats, and we don't want to eat too much saturated fats. But like I said, if we can focus on the positive, we're not constantly thinking about the negative, and we're more likely to include the foods that will be protective for us. So I hope those are all the questions that have been submitted. So we'll end it here, and it's perfect timing. We'll just give a quick plug for tomorrow's webinar with Rob, talking about resistance training at home. And then there's also a plug for next Tuesday, which is the Women with Heart series. And that's going to be a topic about Beyond the Heart, Her Heart Matters, with Dr. Carolina Carvalho. So I hope you can attend both of those sessions. And thank you again for joining us today, for participating in the chat, as well as submitting your questions. We hope that you enjoyed this presentation about mindful eating.
Thanks, everyone.